Welcome back to Indiana Newsdesk. Well, the U.S. is bracing for a coronavirus outbreak and, like we've been saying, taking steps to slow the spread of the virus. But in other countries like Italy, it didn't take long for the coronavirus to quickly overwhelm the healthcare system. And many are warning the same thing could happen here. Katy Howe is the Director of Emergency Services at IU Health Bloomington Hospital. She joins us now. Thank you so much for being here today.
You're welcome.
So just what's the atmosphere, what's the scene right now at the hospital?
Well, I would say that we are very busy preparing for patients and any of those in our community needing our help or in the state of Indiana.
You know, we saw that flattening curve graph earlier. Is there a plan to potentially in place help more people if needed?
Yes. So we've been planning for actually months, just keeping an eye on everything. And we definitely have our incident command center in place, which allows us to kind of take inventory of how many beds we have available, ventilators, and not just here in Bloomington, but across the state. So it's definitely a united force to make sure that we have everything in place.
Here's a question I think I've been hearing the most is the hospital actually testing people?
So currently, everything is vetted through the Indiana State Department of Health. So we screen the patients and we do initial testing that may help rule out other viral things such as influenza or strep throat. And then we do a respiratory viral panel to see if anything else comes up. Once we're at that point, if all of those tests come back negative and the patient, you know, there is concern that they've had contact with someone who's been diagnosed and confirmed with COVID-19, then we would go ahead and contact the state and send off for that testing. And then in the future, we're hoping to have the kits available because right now there is a shortage. You know, there's not enough available for as many people that want to be tested. So we're having to really screen that. Make sure we're getting the right testing to the right people.
Of course, we talk a lot about the patients, but what about medical staff? Are there special procedures going in place right now for them?
Yeah, absolutely. So we have special places in our ED here in Bloomington that we are placing suspected COVID-19 patients and people that we're worried about. So they are kind of in a different area than our normal regular emergency department patients. We have all of our healthcare workers are provided with protective equipment, and that's changing too. Just in the last 24 hours, the CDC has changed it from airborne isolation to droplet and contact isolation, which means that there's different masks that we would need to wear and different donning of that protective equipment. So,
boy, well, thank you so much for being here. We know there's a lot going on, and we'll continue to get updates from you as we move forward.
Absolutely.
Thank you.